we will discuss about the examination of the respiratory system. How to proceed in examination of the respiratory system. So the proper exposure of the patient is very important. We have taken a consent regarding the examination of the patient. So start from the hands. So in a patient of a respiratory disease, you should assess about the first, spread the hands and then assess tremors. So there is a tremor is present, which indicate there is a carbon dioxide retention. Now, we can appreciate here there is a nail. So this is in these nails there is some fungal infection, which indicate there is a usage of steroids or immunocompromised patients. So these are case of a chronic smoker. Now there is a pigmentation, hyperpigmentation, and this is the bruises due to the thinning of the skin secondary to steroid uses. And similarly, there is a on the palmar surface we can appreciate here there is a palmar erythema. Is a classical palmar erythema with loss, wasting of a muscle of a thenar and the hypothenar. Now, similar findings in the hands of these hands, there is a fungal infection or there is a hyperpigmentation and palmar erythema. So these are the bruises, the dryness of the skin here, and these are emaciated persons are using of the steroids for a long period of time. Now we can appreciate in a sitting position the neck vein, there is a congested neck vein and the uses of accessory muscles of the neck. And similarly, there is a purse lip. So the patients need oxygen, and there is a uses of a nose. And there is a wasting in the face, and the wasting of the chest, and these are the shoulder area. So here we can appreciate the shape of the chest. There is a proper abdominal respiration, and there is a AP diameter, or there is a horizontal, or there is a AP diameter. So we can appreciate here there is some pigmented area, the indrawing of the chest area, and indicate there is a respiratory distress. So start from after the inspection, inspection start from head to toe region. So first from the head region, अभी आप कौन सी जगह पे हैं? And you should assess the conscious level of the patient. अभी कौन सी जगह पर है? ये केड़ी जगह है? So you should assess any irritability or the drowsiness, which is most common with the patients of a hyper viscosity or when there is a hypercapnia. So there is a loss of in the forehead. We can appreciate there is a what is these? Wrinkles. The prominent wrinkles show the aging in some patients. And now the eyes, नीचे देखें, ऊपर देखें, and then we can assess the conjunctival congestion. So the patient with the respiratory distress or in the respiratory disease, there is a conjunctival congestion, and the patient with obstructive lung disease in the conjunctival congestion. So there is a discharge. There is a discharge from that. Zaban दिखाएं. So पूरी जुबान का है. मुंह में छाले बनते हैं. Mouth ulcer. We should assess the mouth ulcer regarding the utilization of the different drugs or steroids. Now we can assess here at the foot end, the position of the patient is very important when performing, and you can make a 45 angle. So for a comfortable position. थोड़ा सा ऊपर हो भी. Yes. ठीक है. Now assess the trachea. The first you should assess by the trachea, and this is a region of trachea assessment. The trachea is the center, or there is a deviation. So there is slightly deviated toward the right side, which indicates there is some fibrosis of the fundamental fibrosis secondary to the recurrent infection or less of old pulmonary tuberculosis. Now we assess the patients regarding the front side is the peak organ. So the peak organ examination, we should put the fingers in this space, in this form, in the intercostal space, and to assess the apex. So the apical region of this patient is this is the apex. So apex, we assess the apex from the maximum sternum, second, third, and the fourth, and this is the fifth intercostal space. So here is the 1 centimeter. So this is lateral of mid-clavicular lines. So here, so this is a very important the pre-organ examination in the respiratory disease. Why? Those patients which have got chronic disease, which leads to the pulmonary hypertension. So pulmonary hypertension, the most the area prominent area for the assessment of the pulmonary hypertension in the second intercostal space for the audible or loud P2. And similarly, then we should assess the liver. And the liver is very important because in case of the right side of the heart failure, so the liver will be involved. So assess the liver from here. With the inspiration, your hand inside, or with the expiration is the outside. So assessment of the liver. At the same time, you should assess the spleen. So there is no liver or the spleen enlargement. So this is the hands in the space, and then with the respiration to assess the expansion. So in case of there is a decreased expansion, on that side will be not moved. So these are the upper parts to start from the apical region. So this is the apical region, you should assess the expansion, and then this is the area, and then one more. So the three areas you should assess with further expansion. Similarly, the vocal units. So the liver and the heart is present in these areas. You should assess the focal cortex on a that side. Now the next step is the auscultation from the front side. You should first know how to handle the stethoscope. So this is the way of to use the stethoscopes. So normally fix the stethoscope with this. At the same time, so the best side to assess the front of the chest is the lateral side. Because due to the liver or due to the heart, you are unable to assess some logical things. Now, the next step is to assess the back of the chest. And the similarly, you should pattern of this. So, see that right here? Now, this is the back of the chest of the patient. So, any deformity, any protruberant region, or any distension in the chest. Okay. After the inspection, or any pigmentation, or any hair loss, or any deformity in the spine is very important. So, some diseases we assess during that back of the chest examination, there is a spinal guard. So let's move with the spinal examination of any protruberance or the carry spines to rule out some conditions like the pulmonary tuberculosis or the disseminated tuberculosis involve the spinal area. So now we assess any tenderness in these areas with palpation. Okay, then we move again the expansion of the chest. Lamba सांस लीजिए. And this is the expansion of the chest, going not at the area of the second scapula. So this is the area. So your hand should be inside the intercostal spaces. And then after this, similarly the vocal parameters, एक दो भी हैं. Should be in a space, intercostal space. Now, the percussion, start the percussion in the apical region in the three areas. The human should be in this area. Now, percuss. Then we leave the scapulary region. So your position should be not straight. So you move the hands in this position or in this position. This should be in a straight position. Okay, and then assess the auscultation. And in the last, we assess the center. बहुत मेहरबानी